Good morning. My name is Kanaparthi Bhuvana Dedeepya, studying second year medicine September batch. Today I am going to do physical examination of cranial nerves on Anjali, 45 years old woman. Before doing physical examination, wash or sanitize your hands. Cranial nerve 1, olfactory nerve, which mediates the sense of smell, access its function by compressing one side of the nose and asking the patient to sniff through the other. Ask the patient to close both eyes and pass a substance such as vanilla, clove, coffee under the open nostril. If the patient detects the smell, ask him to identify it. Cranial nerve 2, optic nerve, mediates vision. To access its function, check the patient's visual acuity, visual fields. Cranial nerve 3, 4 and 6, oculomotor, trochlear, abducens. The extraocular movements in the 6 cardinal directions of the gaze and look for conjugate movements in any of the 6 directions. Patient, which if any direction makes the diplola worse, inspect the eye closely for asymmetric deviation of movement. Determine if the dipola is monocular or binocular. Asking the patient to cover one eye or perform the cover uncover test. Ask the patient to look at your finger as you move it toward the bridge of the nose. Eyes can usually follow your finger to within 5 to 8 centimeters. Cranial nerve 5, the trigeminal nerve. Palpate the temporal and masseter muscles. In turn, ask the patient to clench the teeth. Note the strength of the muscle contraction. Then ask the patient to move the jaw from side to side. Test the sensory portion of the trigeminal nerve. Explain to the patient how you will access the pain that is sharp with the patient's eyes closed. Test for the pain sensation using the sterile sharp end of the broken cotton swab stick or some other suitable sharp object to stimulate the patient's forehead and cheeks at the point indicated. Ask the patient to look up and away from you. Approach the patient from the side of his line of vision and lightly touch the cornea with the cotton normally. The patient's eye blink and tear come out. Cranial nerve 7, facial nerve. Observe the patient face at rest and during conversation. Ask the patient to show the teeth and ask the patient to close the eyes so tightly that you cannot open with your hands. Ask the patient to wrinkle his forehead. Ask the patient to puff the cheeks. Ask the patient to tense his neck. Cranial nerve 8, the acoustic nerve. Hearing with whispered voice test. Test the air and bone conduction using the Weber test. Cranial nerve 9 and 10, glossopharyngeal and vagus. Ask the patient to say ah as you observe the soft palate in the pharynx. The palate should rise promptly and symmetrically and vulva should remain midline. Cranial nerve 11, spinal accessory nerve. Ask the patient to strike his shoulders upward against your hands during this maneuver. Elevate the strength and contraction of the trapezius muscle. Turn your chin into my hands strong from in front of the patient. Ask the patient to turn his head to each side against your hand. Observe the contraction of the opposite sternomastoid muscle. Cranial nerve 12, hypoglossal nerve. Ask the patient to stick out his tongue. Note any asymmetry or deviation from the midline. Ask the patient to move the tongue from side to side. Has the examination completed? Thank you very much for watching.